All right, we're just going to wait 1 minute as people are joining the room. So just one moment, please. All right, I think we got a stable number. So let's get started. I would just point out that third bullet point. I believe chat is open, but let's hold questions until the end. I am the only person here, and so I am not going to be able to operate the PowerPoint and answer questions in the chat. And so let's hold those until the end. That way there are not, let's see. Let me try again. And let me ask, are you able to see the screen? Can someone respond to that? You can see the PowerPoint? Okay, good. Okay, and so like I was saying, let's hold questions until the end because I can't do that while doing the PowerPoint at the same time. And that way, if there's a question answered later in the PowerPoint, I won't have to read it out loud anyways. So just to get started, my name is Phil LeBlanc. I am a health professions advisor at Northwestern, and today we're going to talk about the essential extracurriculars. And so that's essentially the extracurricular components of a potential application to a health professions program, and also the various opportunities and resources that we offer here at Northwestern to kind of help you build those. This is a look at our schedule. We are on day 5 of pre-health week. So happy Friday, everybody. If you see a webinar on there that you were not able to attend, these are all being recorded. And so I've been told that they will be put onto the Office of Admissions YouTube page as early as next week. So keep an eye out for that. This is a look at the health professions advising team at Northwestern. And then on the right is a look at our team in a photo booth at last fall's meet and greet. If you decide to attend Northwestern, I would encourage you to attend our meet and greet. This is an event that we host. We have food, we have music, we have a photo booth, and we had representatives from Feinberg, from their medical school, from the Doctor of Physical Therapy program, from the Physician Assistant program, genetic counseling program. So it was an excellent event. And so health professions advising, what we do, what we are, we advise, engage, connect, and prepare undergraduate students and alumni pursuing careers in the health professions. We help them with the application process and everything that goes into that. And again, yes, we do work with alumni. Alums have access to, they can make appointments with their advisor. They can attend all of our workshops. in our information sessions. So again, that's kind of a brief summary of what our office does. And then pre-health at Northwestern is a set of recommended courses and experiences that we share with students, that we communicate to students, that are based, that are made public by health professions programs, and things that they communicate. So we essentially translate, these are the courses at Northwestern that you'll need to meet general course requirements for this particular health professions program. And again, kind of the experiences, which we'll talk about today, that they want to see in that application. In the application process with admissions in health professions, you're going to hear about a holistic review process. And so for that, you see metrics, which pertains to the academic metrics. That would be your GPA, that would be MCAT for medical school, DAT for dentistry, GRE for various health professions programs. I think that was already discussed in one of our webinars. Today, again, we're going to talk about extracurriculars, we're going to talk about experiences. And then there's also personal attributes that come into play as well. I personally feel personal attributes and experiences kind of go hand in hand. And that is to say that you are, by engaging in these experiences, you are developing competencies that, again, are attractive in that these health professions programs want to see in their applicants. And just a little deeper look at that holistic review process at these admission factors. Again, grades, coursework, entrance exams, I think those were discussed in a prior webinar. At the bottom, application, interview, program fit, those are things that you can discuss with a health professions advisor when you get closer to the application process. And then today, we're going to talk about clinical experience, which contains shadowing, clinical volunteering, work, and then we'll discuss research, extracurricular activities, and leadership, and then community service. Again, clinical community service and non-clinical community service. So first, clinical experience. What is it? It is any experience that involves the care and treatment of patients, and ideally one in which you can observe the patient-doctor relationship. Observing the patient-doctor relationship makes for very high-quality clinical experience. Your ability to interact with patients is also indicative of a good quality clinical experience opportunity. As far as clinical experience is critical to an application. The reason being is the medical school or schools wants to be confident that you have a good understanding of the realities of medicine. That's to say, medical schools are not in the business of admitting students who are not going to complete their program. And so that's where, again, they want to make sure that medicine has been tested by you and you really know what you're getting yourself into, and there won't be any surprises once you show up in their program. And then again, also with clinical experience, there is it demonstrates that you're service-minded and you're people-oriented, which are important qualities for physicians. And also that, again, you're committed to the practice of medicine itself. Factors that schools will, take into consideration when evaluating your clinical experience are the length and time of your commitment. And so you can see there in parentheses, it says some schools expect a minimum of 1 year. Our office's recommendation is essentially that we recommend you volunteer a year or more, because medical schools want to see a consistent and extended commitment to clinical experience. And then the depth of the experience is important. So, earlier I talked about patient doctor or seeing the patient doctor interactions, having patient interactions yourself. Those are things that make for a high quality clinical experience, as opposed to, spending your time in the gift shop. And so those are things that, again, will be considered by any potential admissions committee. And then also your ability to communicate the lessons you learned from the experience, being able to reflect on the experience. So I know one thing I encourage all of my advisees to engage in is journaling. That way they can, make a note of any notable or meaningful experiences that they witnessed. That is helpful with the personal statement, years down the road. But it's also helpful, I think, in helping them realize why they're pursuing medicine, the why medicine question. And that's also where the reflections piece, that's also a piece of the journaling template I share with students. And so I think that's another important thing. Undergraduate students have a hard time answering the why medicine question. And so, a lot of students says, well, I want to help people. Well, engaging in clinical experience and then asking yourself, what did this experience show me that, shows that I want to be a physician? Answering those questions after you volunteer for clinical experience, I think can kind of help you with the why medicine and kind of go deeper with that. Research. Research is something that isn't required at a lot of health professions programs. What I kind of tell students is that if research is in the mission statement, then research is probably required. But that's not the case for most programs. However, research is always a value add to an application. And we have a lot of students who are interested in research, and we have a lot of opportunities at Northwestern for research for students. And so a lot of students engage in research for those reasons. And so resources for students at Northwestern who are interested in research, you have the Office of Undergraduate Research. And so they offer workshops about how to pursue research opportunities or how undergraduate students can pursue research opportunities. They have drop-in hours for students who want to pop in and ask a quick question. You can schedule a meeting with the people at the Office of Undergraduate Research. They have an excellent newsletter that comes out every Monday. And in that newsletter, you have, again, they are advertising the workshops that they are putting on. They provide student testimonials that, talk from other undergraduate students so that you have an opportunity to hear from other students what their undergraduate research experience is like. How did they come across this undergraduate research experience, et cetera. And then, of course, they also advertise or promote undergraduate research opportunities that, are taking applications and so forth. And then we have the Office of Fellowships, which the health professions advising, we actually share an office with Office of Fellowships. And so fellowships are domestic and international opportunities for research, for service, things of that nature. And so, again, you can meet with someone in our shared office to kind of discuss that, because some of those are internationally renowned, fellowships and awards. And so you've heard about like Rhodes scholarships and things of that nature. And so that takes a lot of planning to put together a competitive application. And so that is why students meet with the fine folks at the Office of Fellowships and why it requires so much planning. And then we have the Opportunities Finder on our website, where, again, we share research opportunities, jobs, summer programs, things of that nature. So again, you can find research opportunities on there sometimes. And then also the Association of American Medical Colleges Clinical and Research Opportunities website as well will feature research opportunities on there. guidance for leadership and extracurriculars. You know, leadership, I think, carries a lot of hats. It's one of those things where I think a lot of students think I need to be on the exec board for a student club or organization. Need to be president for a club. I had a student who was determined to be the chess club president because they thought it would be easy, and that's not the right approach. I don't think that you have to be president or on the exec board to demonstrate leadership. What I think leadership looks like is taking on responsibility. And what that can look like a variety of different things. And so it could be helping put on an event for your club. It could be assisting with programming efforts. We have like mentorship programs that some of these clubs do and helping with those efforts. I have students who put on trainings to faculty and staff at Northwestern. And so those are some other examples of leadership. And so, like I said, I think it's really another way to look at it than just the title is to be entrusted with this responsibility. And so how does one get to that point? And that's where it's the second bullet point, which is to choose what interests you, to seek out clubs that align with your interests. And so you can see it does not have to be in a health or medicine related setting. We have a lot of students who are involved in a lot of other clubs that are not health and medicine focused. And so, you see a reference to these core competencies. And these core competencies are competencies that, again, the Association of American Medical Colleges listed them and said, we want our applicants to possess these competencies. And so these clubs, again, there's a lot of way to develop those competencies through things beyond the pre-med society. And that's nothing against the pre-med society. It's a great club. But again, we want students to engage in clubs where they're going to show up and be involved and not just sit in a chair, against the wall and not contribute. We want you to be invested in those clubs. And when you become invested, that's when you become more engaged with the activity. You're more comfortable and more likely to help, and you're more likely to be a part of the conversation. And then that's where the responsibility kind of comes in with those things. We have a lot of clubs, and we also have a good website for that, Wildcat Connections, and it has a nice search function, where I was looking for a club and I just typed in book, and books and breakfast populated. And so it's real easy. You can just type in a word of something, again, of interest to you and see what clubs populate, and you might make a note of that. Some resources for service. And so the Volunteer Hub, that's a website, or that's a page on our Health Professions Advising website. And it lists a lot of different hospitals, clinics, senior care centers, some near our university, some in the Chicago region. So you can kind of see where, again, you can volunteer at. And then again, the student groups, we have a page on our website that lists some of the pre-med, pre-health student groups. But again, there's a lot more beyond that you can find on the Wildcat Connections website. And then I would also just point out it references engaging in service through some of these clubs and groups. And in a second, I'm going to talk to you a little bit about a commitment to community service, but a lot of these clubs are involved in that. Some students want to help local schools. And so I mentioned Books and Breakfast. That's one such club that does that. There are others that are involved with tutoring efforts with local schools. There's, the Special Olympics. There's a club that, again, helps with those events in the Evanston region. There's American Cancer Society and so on. And so really take time to think about what causes are important to you? How do you want to give back to the community? What demographics do you want to work with, etc. Other resources for service under spring breaks, there's the NU Docs program that the Feinberg School of Medicine puts on. It's an opportunity. They have sessions with faculty at Feinberg. There is some shadowing opportunities, I believe, involved with that program. Engage Chicago is a summer opportunity that students, it's put on through an office here at Northwestern, and they have information sessions where, depending on your major, what careers, line of careers you're interested in, there's different opportunities in the Chicago area, and there's, different offices that you can volunteer at or work at as a part of Engage Chicago. The Civic Engagement Certificate is another opportunity that students can get involved with, and it has a community service component as well. Moving on, shadowing, mentoring. Shadowing is something that it's kind of like research in that it's not required, because unfortunately not everyone has easy access to shadowing. However, it's always a value add. It's always greatly appreciated by medical schools. And so we encourage all health profession students to, again, seek out shadowing opportunities with a physician, dentist, vet, whatever health track you're interested in, because it always is appreciated by the admissions committee. And so it's one of those things where, not everybody, a lot of people don't know a physician that they can approach about shadowing. I have those conversations frequently with students. I'm having a lot of those conversations now as the summer kind of gets closer and closer. There are different approaches and strategies that, again, I'm happy to discuss with students. There is the next program that Northwestern offers, the Northwestern Externship Program. And so if you register for that and are accepted into that program, that's a 1 or 2 day shadowing opportunity. NewCap, which is the Northwestern University Clinical Assistantship Program, is something that our office has organized, and it is a shadowing program. It's highly competitive, and so it's very far from a guarantee. You should not, bank on being able to participate in that program junior year and then put shadowing on the back burner. Rather, again, it's something that we encourage all students to apply, but it's far from a guarantee. But it is a shadowing program. We have 10 to 12 seats, and we offer it 2 quarters per year. And then these mentoring programs listed, the Northwestern Mentorship Program is something that Northwestern students can register for year-round, and then it allows them to be matched or paired with an alum who is in a career or profession that aligns with one that the student is seeking or pursuing. And so for your pre-med students, it would be an opportunity to match with a physician. And then All Mentoring is another program for identity-based pairings. These connections programs are one where we match undergraduate students who registered for these programs with medical students at the Feinberg School of Medicine, with physician assistant students at the PA program at Feinberg, and with students who are in the Doctor of Physical Therapy program at Feinberg as well. It's an opportunity, that and the Northwestern Mentorship Program, to talk to someone who was in your shoes maybe not all that long ago. You can ask them, how did you find shadowing opportunities? How did you balance organic chemistry and biology? What is medical school like? Things like that. Someone who's been there. This is a look at some data that we collected from students who were accepted into medical school. And so you can see here the non-clinical volunteering hours or community service that students engaged in. Most of those students had over 100 hours of community service. For shadowing, again, that's on the lower side, and it's kind of balanced across there. But like I said, because shadowing can be harder to obtain, I often tell students to kind of take what you can get. If a physician offers to let you shadow for a day or two, to go ahead and take it, just because it can be hard to come by. But again, we're happy to meet with students and discuss how to seek and pursue shadowing opportunities and strategies for that. This is the clinical volunteering hours page. You can see most students had that were accepted into medical school had over 100 clinical volunteer hours. I'll be honest, I think you probably have a lot that are 200 hours or approaching 300 hours as well. Just because, again, our office's recommendation to students is that they engage in a year or more of clinical volunteering. And so what clinical volunteering what that looks like for students around here is typically a 1 4-hour shift per week. So if you were to do that for 1 year, that would be over 200 hours. And so again, I would, based on our recommendations, aim for probably closer to 300 hours. I shared a lot with you, and so what we don't want to have happen is for you to show up here or another institution and to try to do all these things in the fall. Again, you can see the first year expectation is to focus on coursework and to transition to college. That's to say, college is different. You will have to adjust. And so focus on doing well in your classes, focus on getting adjusted to the pace of university. And then when you're comfortable and you have spare time, that you're not sure what to do with, that's when to kind of start exploring these things. All right. I think number one, I'm going to try to answer some questions here. If I'm unable to do that, first, go ahead and feel free to put questions in the chat now. If I don't get to your question, feel free to send it to premed-prehealth@northwestern.edu. You can also, if you go to our website and you click on Get Advising, there is a Ask an Advisor link where, again, you can submit your questions there as well. So, questions. Yes, the first question that I see is, will the presentation be available to browse through following this webinar? This recording will be available. Again, this recording will be made available on the Office of Admissions website. So let me see here. We're kind of moving fast. Are there any volunteering shadowing programs for high schoolers that you would recommend? I don't know. What I would probably point you to, just because I don't work with high school students, I work with undergraduate students. And so one resource that I referenced here is the AAMC Clinical and Research Opportunities website. And so that is something that you could look at for volunteering in shadowing programs for high school students. I know that we have some students that also we have some student organizations that organize mentoring with high school students. So I don't know if there's something like that at an institution closer to you. So again, I'm seeing a couple questions about these webinar recordings. Again, they're not available yet. I was told that it sounded like they'll be available next week on Northwestern's admissions YouTube page. And so I see, if you have shadow hours from high school, will they carry over into college med school application? It's one of those things where I would mention them, I would include them, but I would continue to probably seek out shadowing opportunities in college, just because medical schools typically want to see those things tested in college as opposed to high school. Now, it could depend on the number of hours of shadowing you have. If it's an extensive amount of time, then you might look at other opportunities. But if you have a smaller number, that's where I would definitely encourage you to continue to explore shadowing in college. How many clubs do I think is manageable? That depends on the individual. It's one of those things where I absolutely encourage students to engage in outside the classroom activities. Some students love it. You don't have to push them too hard, but then they take too much on. And that can mean a couple things. It can mean your grades take a hit, which we don't want. And it could also mean that you're not performing at a high level and meeting expectations for your club members, that you're falling short with your student club or organization, which is also not a good reflection on you and something that you want to avoid. So it's really about balance. And on my last slide, balance is really important in college. And that's something that you'll, again, that's part of the adjustment. I'm trying to think, I think one point I had on the last slide was it's okay to spread things out. And so again, try a club, see if you have the time for it. And if you still have time and you think you can take more on, then you might feel comfortable doing that. But you don't want to, like I said, show up and engage in a lot of commitments early on and be stretched too thin and have it negatively impact your grades. Sports extracurriculars help in any way to application? Absolutely, they can. If you're a student athlete, that's one of those things where that is, there's a lot of responsibility just in terms of the time commitment, being able to balance the demands of sports and practice and film study and travel with the rigors of your courses. So that's something that is appreciated. There's the leadership component. And then there's also, that is student athletes, but there's also the student organizations. And so I've had a number of students who have been engaged in martial arts in particular. And so that's one where I view it as a sport. And so that's one where there's leadership potential. Students who are very invested in that and learned a lot from those clubs. Does shadowing medical professionals have to be in North American hospitals? Could I shadow somewhere in Europe or Asia? You can get shadowing opportunities outside of the United States, but there are guidelines that the Association of American Medical Colleges wants you to follow. And essentially that you would follow at any hospital in the United States. If you're not allowed to do it here, don't do it abroad, because that would be an ethical breach, and that's frowned upon by medical schools. So I'm trying to think. Do I recommend obtaining medical certification for working at clinics instead of just passively shadowing? That is a personal decision for you to make. Most students that I work with volunteer. It's not because it's better, it's because that is what fits into their schedule most convenient. They're able to accommodate that with their course load. And so, like I said, it's 1 4-hour shift per week. And so most students are able to find 4 hours to do that. I have undergraduate students who have worked and it's required, to be certified, whether as a CNA or as an EMT, but that's something few students are able to do. And so while going to school, we have a lot of students who do that in their gap year. But it's just much more common for students to volunteer because again, that's what fits with their schedule easier. That's not to say that you can't work. Have had some students work over the summer, have had some students work during school year, but that's few. What our recommendation really is don't get a certification unless you plan on using it. I think some students used to get a certification thinking the certification itself, looked good on their resume or their application, but it doesn't. It's the hours that you would, work in that field or discipline that is what medical schools are looking for. What percentage of Northwestern pre-med students get accepted into medical school? I don't have that handy. I'm sure it was mentioned on another presentation. Because I know we do show that data. I'm trying to pull it up. I don't have it handy. What I have handy is accepted applicant data based on GPA. Yeah, I'm sorry, I don't have that handy, and I don't want to give a number, throw a number out there that I'm not confident. Again, that's something, email pre-med-prehealth at northwestern.edu, and we'll respond with that information because it's information we pass around. I just am not able to pull it up in a timely manner. Do I recommend shadowing in many different areas or stick to your interests? I usually tell students to take any shadowing opportunity they can get despite the specialty. So would a high number of shadowing clinical volunteering hours offset a shorter period of time? What I would say is that what I tell students is this isn't something you're just going to do over one summer and check that box and be done. Like I said, the reason why we say a year or more is it's our understanding that medical schools want to see an extended commitment to clinical experience. And so that's why we recommend a year or more. Would I say that mentoring would be more beneficial than shadowing, or should both be paid equal attention? I think they both have value, and I would look to engage in both. I think shadowing has more value because it would be a medical school would value it greater. I think the mentoring has a lot of personal value that could help you get answers to your questions. It would be an opportunity, like I said, to talk to someone who was in your shoes at one time, who is now a medical student, who is now a practicing physician. And you could ask them, I did not earn a medical degree. I did not go to medical school, but this is an opportunity to talk to someone who is there. And you can ask them about their experience at medical school, or you can talk to them about, again, how they built their medical school application. How did they find shadowing? How did they balance organic chemistry and biology? Things that they were successful pre-med students. And I'd want to pick their brain to see how they did that. So again, I think there's personal value there, more so than to your application with regard to mentoring. Oh, good question. Is there a particular major that is optimal for acceptance to medical school? The answer is no. You have a lot of biology majors that, apply to medical school, but it doesn't matter. The main thing is that you meet the prerequisite course requirements, and that you engage in these extracurriculars that we talked about today. And so it's one of those things where, you know, medical schools don't care what your major is, but it's one of those things where, obviously some don't have as many STEM courses. And so you need to make sure that you do well in your pre-med courses, since each course will greater influence your STEM or science GPA, which is important to the application process. If we do have research, clinical experience and volunteer experience in high school, should they be listed in our med school application? It depends. Like I said, medical schools like to see those things tested and taking place in college. That's not to say that you can't list them. What it will probably come down to is how many experiences you can list in your application. In the medical school application, there's the work and activity section where you can list 15 experiences. So depending on how many experiences you can list will probably dictate whether or not you have the option of listing a high school experience like that or not. Ideally, again, you'll have engaged in a lot of the extracurriculars that we just talked about, and there will be no room for these high school experiences. But if you have room, that's where you might be able to put something like that in there. So would it be helpful to get a certification to then gain clinical experience while in school? Possibly. Like I said, for most students, they don't have the time for that. If you are interested in working as a CNA, for example, and you think you can do it and it not negatively impact your grades, it depends on the student. I know some students have a choice, but some students may not have a choice with regard to work. And so that's where if you want to work as a CNA, if you feel obligated to work as a CNA, not from medical schools, but from some other need, then again, it wouldn't hurt a med school application. It would look fine on a med school application. But if you do that and your grades drop from B's to C's, then you probably did yourself a disservice. Oh, yeah, a lot of questions. I'm probably going to have to wrap us up because we are over our time. This officially ended 13 minutes ago. I thought I could get through all of our questions, but I see more just keep popping up. Would pre-med students also want to shadow other healthcare professionals other than physicians? I don't think there's anything wrong with that. I think that would be viewed as clinical experience. It would be an opportunity again for you to potentially see physician-patient interaction, or even again, patient interaction itself is value, be it with a nurse, a physician's assistant, whoever it might be. And so I think there's value in that. But again, I don't know. It just kind of depends on that opportunity. If you know somebody who works in healthcare who is willing to let you shadow them, then I think there's value in that. But I don't know that it'd be worth your time to reach out to cold email nurses, physicians, assistants, etc., about shadowing them, because I don't know that they would be interested in aiding some. They would probably want a pre-physician assistant student to shadow them, or a pre-nursing student to shadow them. So I don't think it would yield the results that you're hoping for if you're not in that health track. Thank you, everyone. I'm going to end it there. Like I said, each of these webinars this week were recorded, and they should appear on the Office of Admissions YouTube page next week. Have a great weekend.